Hello, and thanks for joining CRE Talks for the next 30 minutes. ICBR and CREA Indiana are glad that you're here. And ICBR and CREA strive to bring you industry experts and innovators in commercial real estate. Today, you will gain insight into the creative ways that medical and healthcare real estate has evolved this last year. We'll hear how there's been an increase of 46% in telehealth or remote doctor's appointments, and what that means for an increase or a decrease in healthcare real estate space. We'll also hear more about the challenges of the healthcare systems and what they're facing today. We are joined today by Kevin Schultz. Kevin is the Parkview Health Systems Director of Real Estate and Property Management in Fort Wayne, and Tim Norton from Colliers International in Indianapolis. He serves as the Executive Vice President. Welcome, Kevin and Tim. We appreciate you being here today. Thanks again, Kevin, for joining us today. And we know that the Parkview Systems mission is to do good and serves the community as a non-for-profit. What would be one or two trends or strategies that you've been watching closely with the respect from non-for-profit versus for-profit hospitals?
I think what we're seeing a lot there is not-for-profit hospitals really focusing on community health and community engagement and just that full spectrum of care, which can include education and other things that just maybe aren't clinical in nature to achieve those kind of best outcomes and really be accountable to the community.
Yeah, we know that commercial real estate brokers have been key consulting partners and clients like Parkview, and really helpful in making those business decisions on current and future spaces. What has been helpful to you and in turn Parkview when you've been looking at those consulting opportunities?
I've had a lot of success with brokers around just the ability to negotiate certain terms because of their their history and skill, access to data that we may not have. And we keep a lot of data, but not data similar to what a commercial real estate agent might have about the market as a whole. So that's been very helpful to us. And just that kind of market knowledge, comps, and utilization. One of our big things is around space utilization. So really getting someone engaged from the outside that can kind of look at things differently.
Yeah, what do you want brokers to know about healthcare needs today versus maybe 6 months ago, 12 months ago?
Well, I read the question and I thought a little bit about it. And what comes to mind for me is that our space, our real estate needs to be efficient and effective. There's constant pressures in the healthcare industry for costs and rates. And for us to be able to operate clinics effectively and efficiently, we need the best deals out there. So, counting on brokers to really help us out with that.
Could you speak a little bit about maybe what a new efficiency is that you have been successful on this last year?
A lot of it is around utilization. So understanding how the existing space is utilized and maximizing that before moving to expand or find additional space. Construction costs are constantly going up. And medical has very specific build outs. So to the extent that there's medical space out there somewhere, I want to see it all. So I always tell the brokers I work with, I said, if you see anything out there that's a medical office space, show it to me, because it may just work, because we can get in there and it doesn't cost $1 million if we can largely use it as is. So that's really a key, at least in my world, and it doesn't exist a lot in some of our markets. Fort Wayne market, there's more of that kind of opportunity. But as you get into some of the more rural markets, there really isn't a lot of space to begin with. So you're left with land and building, or going into maybe something that's a little bit older and doesn't really reflect the brand that you're trying to achieve.
Yeah, for sure. It's definitely different space the farther you get out, maybe from Fort Wayne and other areas. These next few questions are specific to maybe what brokers are looking for some information. And one would be, have the lease rates increased or decreased for medical space versus the admin space, or even something that would be a hybrid space?
We haven't seen much movement on rates here. They've remained fairly flat. In fact, in some cases, our escalations are outrunning the market. So we may look at a lease that has escalated 2% each year and find that it's more than fair market value. And I would say that's the case over the last probably 3 years. And over the last 12 months, there's not probably enough activity to really say, but it does appear that they're just kind of remaining flat. Not a lot of movement in this market.
So thinking of all the COVID safety measures that you've been a part of putting in place, has the cost to clean space per square foot in admin buildings versus the healthcare spaces changed?
It did during the height of the pandemic, because we really didn't know how to manage through it. So we were doing deep cleans if there was any potential exposure, and those cleanings cost a lot of money. So we've since mastered it, and decided when we need to do it. And I think health systems have just learned a lot over the course of this pandemic that has allowed them to become more efficient in managing it. So I would say, our costs, aside from maybe a couple additional day porters, our costs going forward will, I think, start to get back to just some level of normalcy. In fact, I think this fiscal year we'll probably see it get back to normal.
What would you say about utilities? Have some of those costs per square foot changed, maybe since COVID or moving forward in 2021?
We haven't seen it yet, but it's coming because we did a lot of renovation to HVAC systems for negative air pressure rooms. And we haven't seen quite the impact of that yet, but we know it's coming.
Mm-hmm.
So that's one thing. In addition to all the construction dollars spent, you're going to have these long-term higher utilities. But we have an energy plan, and it's been implemented at a few of our hospitals, and we're taking that plan sort of on the road to outpatient clinics. So we're trying to combat those increased energy costs with some with a good energy plan to try and keep those costs as low as possible. So that includes like just setbacks. A lot of it's just timing, but building automation systems, those kind of things. So
Yeah, as we look to the future and knowing what the community needs are there certain Parkview buildings that are now obsolete? And are you looking to new builds? You were mentioning the rural areas and maybe needing to build something there instead of retrofitting.
Yes. So Parkview's had a lot of growth in the last 10 years. So a lot of our buildings are fairly new. But when we do get into the rural areas, we don't find much luck. I mean, we've got a couple of things we've been working on for 2 years, trying to identify adequate space, and it's just not there. So, or if it is, it doesn't fit the brand, which has become important. So I do, retrofitting space is a big challenge. If it's under 5,000 square feet, I think it's probably worth pushing that. But anything maybe 10 and over, that probably makes more sense to build.
All right, Tim, thanks again for being here today. And we'll just jump right in. And if you want to share a little bit about how you got into the commercial real estate industry.
Yeah, sure. Thank you for inviting me, Lisa. I come by the industry honestly, albeit dragging my feet. My dad has been in the commercial real estate business forever, was one of the partners in the first commercial real estate firm in Indiana. And I always said I would never go into that business. So fast forward 27 and a half years later, here I am.
Well, we're so glad that your dad got you into this business, maybe reluctantly, and I'm glad you've had a successful career there in Indianapolis with Colliers. As we know, we've been in the pandemic for close to a year, and much of 2020 was spent reacting to the pandemic and working with those clients, and knowing that a lot of consulting goes into those relationships. What are you hearing from the clients, and what are they wanting to consult on? Maybe share one or two things that you're hearing from them.
What we're seeing, what we're hearing the most is, number one, anything that contributes to the cost of care. So, for example, this is something that U Health did with Colliers a couple of years ago, looking at supply chain optimization. How do we make that tighter? How do we make that more streamlined? What is a more viable function of our supply chain? It's made a huge difference for them, both in the speed, the time, the employment, and the cost of the goods. So a lot of health systems and a lot of multi-site practices are looking at the supply chain. In addition to that, we have, I would say, our business has really shifted from being transactional work to more consultative. So we're helping these practices and systems really analyze what is our strategic plan. Not just that, but what were the assumptions that we made to create this strategic plan? Because assumptions made 3 years ago or last year may not hold true today, right? That may not be our new reality. So it's really looking at those assumptions, and then how does that play into our new strategic plan? So I'd say that would be number one. Number two would, everybody is vying for being the most accessible healthcare option for patients. They all want the market share. So again, back to what we've been doing, our clients, especially the multi-site practices and health systems, have been utilizing us to really analyze where their business is coming from. What are the referrals? What are the modalities that we're doing? What is the most profitable procedures that we're doing? And what does that look like? Where are we having duplicity in the market? Where are we oversaturated? Where is there a lack of business? And so we've done a lot of organizing and evaluating and putting that into forms and methods that we can analyze, and then bring them to maybe a consolidation in a key location and creating these centers of excellence, thereby reducing the amount of employment that's needed, increasing the modalities, increasing the paying reimbursables. And so it's really looking at doing it a little bit smarter than just running out to every emerging market. So I think that will be our future, really having a more analytical, proactive role versus just chasing the market.
Yeah, we definitely know that the pandemic has accelerated the development of how remote health and telehealth services have been provided. I'm sure that's a lot of what you've been consulting on as well. So how are consultants planning for those future needs, and they're doing it right now, creating those spaces for the telehealth versus the traditional healthcare spaces?
Correct, right. Well, we all know, all of us that are in the healthcare sector, that healthcare doesn't change quickly, and physicians aren't the fastest or ones to want to change their process. So one good thing from the pandemic is it's pushed some of these agendas that probably would have taken years to get through. So in telehealth, it's been a great thing to come out of the pandemic. I think they were saying there was a 46% increase in 2020 alone of people scheduling virtual visits. And they were saying over 1 billion people had virtual visits in 2020. So that gives you the feel of how quickly the healthcare system has had to adapt and make these changes. There's going to be, it's going to be kind of a parity between inpatient and, or not inpatient, but in-person and telehealth, and it should be a complementary service. So from a real estate perspective, we're looking at it, we're constantly getting asked the question, well, does that mean we're going to be able to reduce the size of our space? And our answer is not necessarily, because what will happen is we have to keep that social distance, right? So while we may have less people in at a time, we will have to look at them differently and see them differently. It may be that we see a reduction in the consultation rooms. And what we're seeing then is, okay, are there other modalities or other procedures that we can bring in that will be profitable to backfill that?
Yeah, I think access and efficiencies are two things that we've all improved on this past year, and looking at things a little bit differently and knowing that we're going to always have that as we move in the future. Is there a trend that you're watching closely in the healthcare commercial real estate space?
Absolutely. And this will go back, this actually plays into what we just talked about with telehealth, but it's going to play out in medical office space as well, and that's reimbursables. Unfortunately, so much of how we deliver healthcare is based on the reimbursables from the insurance companies. The Healthcare Act for 2020 in the pandemic really helped these practices do telehealth because they were able to reimburse at the same rates. When that goes away, or if that goes away, because it was a short-term plan, it may look different. Will practices want to continue that level of telehealth when it's getting reimbursed at a lesser rate? And the same is holding true for medical office space. Right now, it favors, the reimbursables favor going to medical office buildings and ambulatory centers versus health systems themselves. So we're watching that very carefully because that will determine how the space is delivered. And if that is office buildings and ambulatory centers, that will play to our vacancy, our availability, our emerging markets, and it will have to have a very good sense of how that is moving. Conversely, if it's away from the health systems or they're moving into different markets and readjusting how they do business, that could make some of the MOBs and other medical space obsolete in certain areas. So it's really making sure that we're having our clients in a really flexible position to take advantage of and react quickly to any of these changes from the government that we might see.
Yeah, it's always going to be something to be watching closely and working together as we learn more about what the trends are. I want to thank you for being here today,
Sure.
and I'm glad to have your insights and expertise. We can all learn a little bit more about this, and look forward to seeing you at other events and hopefully in person later this year.
Absolutely. Thank you for inviting me, Lisa. I appreciate the time.
Once again, thank you, Kevin and Tim, for joining us today and offering your valuable insights as we move farther into 2021 and sharing your expertise in the medical and healthcare real estate world. At this time, we'll have a few minutes to break up into some breakout rooms and have further discussion with both Kevin and Tim. If you want to click on join a breakout room, and you'll have a chance to chat, and then we'll bring us back together in a few minutes. So see you in a few.